My name is Sam Haas, and I'm doing my presentation on multiple sclerosis. Multiple sclerosis is an inflammatory immune-mediated disease that attacks the central nervous system. Something that I found interesting right off the bat was just about the name of the disease. I had always been under the impression that it was an autoimmune disease, but many experts of the disease actually prefer to call it this immune-mediated disease, as the exact antigen affecting the multiple sclerosis is unknown. To be more specific, the central nervous system is attacking the fatty substance around the nerve, which we know is the myelin, as well as the nerve itself. And then once that myelin is damaged, it creates a scar, and that's where the name of the disease actually comes from, the sclerosis part. The scarring of the myelin creates an obstruction for the nerve impulse from the brain, and it cannot get through, which produces the many symptoms of multiple sclerosis. For pathophysiology, myelin's role in the central nervous system, it acts as the insulator, as we know. It's created by the oligodendrocytes in the central nervous system, and it's comprised 20% of fats and 80% of lipids. It houses this nerve fiber, like I said, it's the insulator for them, and the insulation is actually what allows for the action potentials to travel more quickly, and in turn, they're able to jump from one to the other. This is what's known as salutatory conduction. Now, this is just a picture showing the difference between a normal cell that's myelinated, or neuron, I'm sorry, that's myelinated, and then one that is damaged, someone who has multiple sclerosis with the deteriorating myelin sheath. So for T cells and their role in multiple sclerosis, they are a type of white blood cell that is produced by the immune system. These cells are activated and they initiate this immune response against the destroyed myelin. The activation of these cells actually allows for other immune cells to come help this issue, and then they're in turn destroying the oligodendrocytes and myelin, and the myelin begins to deteriorate. That's when the scarring occurs, and then ultimately they're just going to be left with complete destruction of the axon. So there are 4 courses of progression that MS can take. You have relapsing remitting, primary progressive, secondary progressive, and progressive relapsing. The relapse remitting is characterized by relapses of the disease, followed by a full recovery or a deficit after the recovery, and then there's no progression of the symptoms in the recovery stage. The primary progressive is progression of the disease from the beginning, with infrequent plateaus and temporary improvements here and there. However, the clinical status continues to worsen with no major remissions in between at all. The secondary progressive actually starts out as the relapse remitting, but progresses with or without infrequent relapses, plateaus, and remissions, kind of just all over the place. And then progressive relapsing is progressive from the onset, with short indefinite relapses in between. With recovery, it might not have recovery. It's just progressive from the beginning. This next slide just shows you everything I just said kind of put down in a diagram. You can see where the relapses are. You can see where the remission and the recovery are. You can see just the constant progressive, like in the primary progressive. They're just all different, and they just show you the different progressions. So what causes multiple sclerosis? There are many factors that are known to cause MS. They could be broken down into 4 other categories or main categories: the environmental, immunologic, infectious, and genetic. Environmental factors include where you live, and then in turn how much vitamin D you're getting, as well as if you're a smoker. Immunologic factors would include having that poor immune system and attacking components that are in the central nervous system then. The infectious factors include being exposed to different viruses and bacteria. And scientists are actually looking at several different diseases to see if there is a link between that and MS. So if someone had some sort of disease when they were younger, or if they still had it, if you have any bacteria in your body from one of these diseases, and then you eventually get multiple sclerosis, they're looking to see what's similar, what's the connection there with those. And for genetic factors, it would just be if one parent had MS, then the child would obviously have a slightly higher chance of having that as well. Signs and symptoms of MS, there are quite a few. On the next slide, I'll show you which ones are the most common, but mainly it's it's the things that are really debilitating them, keeping them from living their daily lives. The spasticity is a huge one where their muscles are just contracting on their own. Fatigue, walking difficulties for obvious reasons. If their muscles are, essentially the nerves are hardening, they can't really use them the way that you or I would actually use them. So here is the diagram that just shows which ones are most common. You can see they're obviously bigger and they're in red. The numbness and tingling, fatigue, the muscle spasms, walking difficulty. There's obviously other things that come along with it. Depression is a huge thing that people with MS have to deal with because of the debilitating nature of their disease. Epidemiology, multiple sclerosis affects more than 2.3 million people all over the world, but specific to the United States, there's more than 400,000 cases. It is most commonly diagnosed in people between the ages of 20 and 50 years old, although people who are younger could obviously get it. People who are older, it's just that's the typical time frame that they're diagnosing people, or they see the diagnoses. MS is 2 to 3 times more common in women than it is in men. And the average person, someone who lives a typical life, doesn't have any prior family history of MS, anything, they would have about 0.1% chance of developing it, which is about 1 in 750 people. But for people who have a first degree relative, such as a sibling, that chance rises up to about 2.5 to 5%. Research actually supports that all ethnicities are affected by multiple sclerosis. The most common would be among Caucasians and people of Northern European ancestry. As far as treatment, multiple sclerosis is treatable, it is not curable. Medication is a huge supporter, exercises as well, which I'll get into later, but medication can just help to slow down the progression of MS and to help prevent those relapses. The drugs they use, they call disease-modifying drugs. They're used to help suppress that immune system response to stop from attacking the myelin. The most common I saw were the beta-seron. This medication is the same. It's the protein that we have in our bodies, interferon, that works to slow the progression of MS as well as decrease the number of weakness attacks on the body. And then the Copaxone treats relapsing MS. It is used to stop attacks by the immune system on the brain and spinal cord. The beta-seron and the Copaxone are actually both injected subcutaneously. And then for the bottom, I have the Aubagio, Galenia, Tecfidera. They're all oral medications. There were a ton of different oral medications. I just picked a couple that I saw were pretty common, and they can be taken once or twice daily. The common pattern I saw amongst the oral medication were the negative side effects that they all carried. They could lower the heart rate. They can make someone have diarrhea, vomiting, nausea. The heart rate is something that it really jumped out to me because as a exercise prescriptioner, I would be wanting to know if someone's heart rate is going to be lowered because of a medication and not just because it's lowering while they're exercising or while other things are going on. So assessment and diagnosis of MS, medical history and neurological exams are the two means of focus when it comes to determining if it's MS or not. Medical history would just provide someone's past symptoms, but their current symptoms are something that would be relevant to diagnosing the MS. The neurological examination would provide information on how the nervous system is working, and this can be seen through MRIs. Spinal fluid can actually be drawn to detect an elevated immune response. And then blood tests are not a direct determinant of multiple sclerosis, meaning you wouldn't be able to tell just by someone's blood if they have this disease, but it's used to kind of rule out any other diseases that have similar signs and symptoms. As you saw, there's so many symptoms that other diseases could also have, so that just kind of rules out the others as opposed to just determining, oh, it's multiple sclerosis based off of this. The effects of multiple sclerosis on exercise response. When looking at someone with MS as opposed to someone without MS, their oxygen consumption increases as well as their arterial blood pressure. It's going to decrease. They'll have an increase in their core temperature, and then their skeletal muscle is actually going to fatigue a lot earlier than someone who does not have MS. For obvious reasons, they're a fatigued person because they have this disease to begin with. For my case study, I came up with a girl, her name is Jess, who's 27 years old, Caucasian. She was diagnosed with the relapsed remitting MS when she was 20 years old. She has no family members with MS or any cardiovascular disease. Her BMI is 28. She lives a sedentary lifestyle because of these debilitating effects of her disease, and she takes the beta-seron daily to help with her MS. She was a previous smoker. She quit when she was diagnosed, so that was about 7 years ago. Her blood pressure is 100 over 70. She has a fasting blood glucose of 102. Her lipid levels, she has a 132 for LDLs and 50 for HDLs. And then my client reported that she suffers from ataxia and vertigo throughout the day. Ataxia is just loss of full control of bodily movements. This has deterred her, obviously, from wanting to exercise for fear of, not being able to. She might fall. She might um, not be able to do any of the activities that she would normally want to do. So her ultimate goal is to increase her muscular strength and cardiorespiratory endurance so that she could eventually participate in different workout classes with girlfriends like she used to before she was diagnosed with MS. So just get back to that regular activity that she initially had without the concern. Obviously, she'll have the concern, but more confidence, I guess. So to stratify the risk, her age was not a factor. Family history, there was nothing there. She was a cigarette smoker, but it was more than 6 months ago that she quit. She lives a sedentary lifestyle, which is a risk. A BMI of 20, which is less than the 30 that was optimal, so that is not a risk. She has for hypertension, it's 100 over 70. The hypertensive would be 140 over 90, so this is not a risk. Her LDLs are 132, which is greater than the 130 for optimal, and the 50 was greater than the 40 for the optimal. So those would both be a risk there. And then for fasting glucose, she has a 102, which is greater than the 100, which is another risk, which completely stratifies her as moderate risk. As far as exercise testing goes, I would perform the following tests before. For cardiovascular endurance, I would have her do a leg cycle ergometer to prevent the risk of falling since she has this disease. My plan would be to use the RPE scale so that she can let me know how she's feeling as she goes since she is fatigued more easily. Musculoskeletal, I could do the 1RM, but as an alternative, I would probably have her repeat as many repetitions as she could at a light resistance to fatigue. Since that would be a little easier on her, and if the 1RM, if she has weak muscles already, she hasn't worked out in a while, that would be kind of risky. Flexibility, something that would be key for her. I would have her do slow and gentle stretching because her muscles might be affected by that spasticity, and this would be done lying down or sitting to reduce any risk of fall as well. So for the prescription, for the cardiovascular training, I would have her work out 3 to 5 times a week at a moderate intensity, something like 40 to 70% of her VO2 reserve. Like I said, that's kind of hard to determine, so I would have her use the RPE scale and keep her about between 11 and 14. 30 minutes, or if she can't do 30 minutes, I would split it up into 3 10-minute circuits, and then as weeks went by, we would work our way up to 60 minutes if possible. And I would start out with the cyclogram as she feels more comfortable, move her to the treadmill, walking outside, elliptical, things like that, once she's feeling more comfortable. Resistance training, I would have her do at least 2 times a week, 60 to 80% of her 1RM with 8 to 15 repetitions for 1 to 2 sets, around 30 minutes. And if she's fatiguing more, increase the set times, the time between the set times. Using machine weights, elastic bands. Stair climbing is something I thought was really important because that's something she'll be doing in her everyday life. So I would like to incorporate that as well. And then flexibility, just having her stretch before and after, to the point of slight discomfort. That's really key for her since she would have these debilitating issues with her muscles. So in conclusion, multiple sclerosis is an immune-mediated disease that attacks the central nervous system, leaving someone with all of these symptoms that are just so awful to go through your everyday life with. And although there is no cure for this disease, with a combination of medications, if it applies, and exercise, someone could really help to control their symptoms when they are dealing with multiple sclerosis. Keeping in mind that it is important to start out with exercise once you're diagnosed, even before, but from the beginning to end, because it is such a deteriorating disease on the muscles and the body. So also keeping in mind, in addition to that, having someone supervise someone with MS is really important in making sure that they are working out safely and effectively based off of their disease and the issues they have. Thanks very much.